With our ageing population, it means many women will be living half of their life post-menopausal, leading to an increase in chronic illnesses. To explain the different stages of menopause and the pros and cons of hormonal and other menopausal therapies to manage the sometimes devastating symptoms is our resident Dr. Frances Pitsilis. Good morning, Dr. Frances.
Good morning, Carly.
Oh, menopause just seems like such a horrible thing for women to have to go through. I mean, for some people, it can be just terrible.
Well,
Why?
well, what seems to happen is that as you approach and then go through menopause, you start to lose your progesterone first, and people don't realise that, but they can start getting migraines, premenstrual tension, and hot flushes, even though they're still having a cycle. So that's your progesterone starting to deplete. And then after that, at some stage, often after your periods have stopped, you then lose your estrogen, and then you lose your testosterone, and that all of this has wide-reaching effects all over the body. Now, women are living longer these days, and we need to be aware of how hormones affect their health as they age, and can we do anything to prevent some of these chronic illnesses? Now, menopause occurs between the age of 45 and 55, but more likely 48 to 52. And premature menopause is before the age of 30. Surgical menopause is when you have a hysterectomy and your ovaries are removed, and that's a sudden change in your hormones. And then that phase that I described, where you approach menopause and you start losing your progesterone, that's called the menopausal transition.
Well, Dr. Frances, what are the symptoms of menopause and postmenopause?
Right. Well, as we approach it, we start to get heavy, painful periods, premenstrual syndrome, hot flushes, even though we're still having a cycle. And then ultimately, the change of your hormonal status affects your whole body. Now, in the brain, it causes sleep disturbance, hot flushes, anxiety, depression, moodiness, memory loss, difficulty thinking and functioning properly with your brain. In the musculoskeletal system, it can cause aches and pains. It can cause reducing muscle and bone mineral loss. In the heart, it can cause cholesterol to go up, more blood pressure, heart disease, diabetes type 2, and even I've had women starting to say, look, I'm getting fat around the trunk, and visceral obesity, which is a concern. And then finally, in the genitourinary tract, we find dry vagina, painful intercourse, and problems with bladder control. Now, 75% of women get these symptoms, 20% severely, and about 40% of women seek help.
So, what is the treatment, Dr. Frances, of menopause symptoms, or do you just have to ride it out?
Well, you can write it out if they're not very severe, and if you're functioning really well and you don't want hormones or you don't want to do anything. But if they're severe, they can affect your health. And then what you really need to do is have a consultation with your doctor and look at your individual situation, because if you have no history of any cancer and you're a well person, but it's really significantly affecting your function, you can ask about hormonal therapy. As you approach the stopping of your periods, the transition, micronized progesterone can be enough to get rid of your hot flushes, help you sleep, and control the moodiness and those heavy, painful periods. After that, as you progress, you can add in the transdermal, that means on the skin, estrogen patches. And the international guideline groups are telling us that it should always be estrogen through the skin and micronized progesterone, which is the safe one. And then after that, what we know is that if you commence that therapy within 10 years of menopause and then keep it going for 5 years, at the moment the experts are telling us that that's the safe window.
I'm just thinking about in the lead up to menopause, given that you know that it sort of can begin in early 40s or more likely later 40s. Can you do anything, if you got your hormone levels as balanced as you possibly could going into menopause, does that, guarantee you that you'll have an easier ride?
Actually, that's a good question, Carly. A lot of women come to me before menopause, but they're going through the difficulties that lack of progesterone gives them. It's called estrogen dominance in some circles. And just giving and correcting that estrogen, along with correcting vitamin, zinc, magnesium, etc., helps them to sleep better, helps them to function better, and it does buffer them through menopause.
I often hear people talk about something called HRT. What is that one?
Well, actually, HRT means hormone replacement therapy, and that generally means, in doctors' minds, estrogen and progesterone, right? Now, the new term is MHT, menopausal hormonal therapy.
So who should not have MHT?
Right. Anyone who's had breast cancer, endometrial cancer, or any hormone-dependent cancers, undiagnosed vaginal bleeding, and you must, if you've got to consider it for other people with chronic illnesses, it must be through the skin, not oral. Oral estrogens increase inflammation and blood clotting, so we know that through the skin is the best. And when you're looking at chronic liver disease, people who get blood clots, and established heart disease, we don't really want any oral estrogen there.
So finally, Dr. Frances, what is available that's not hormones that can be helpful, you know, if you've got breast cancer or you can't take that MHT?
Well, believe it or not, soy foods. Now, particularly in Asian people who can actually respond to the soy foods, the ingredients, the genistein in the soy foods a lot more, because we know it protects the breasts, it lowers hot flushes, and it actually lowers blood pressure. So soy foods. Antidepressants work, and that's because estrogen helps serotonin. When you haven't got enough estrogen, you need help for your serotonin from somewhere else. So the antidepressants work. St. John's wort works for hot flushes and mild to moderate depression, but you can't have St. John's wort along with antidepressants. There's a herb called Vitex, which can help flushes and sleep. We know that correcting vitamin D deficiency helps. And we also know that B vitamins, zinc, and particularly magnesium is very helpful, which helps hot flushes and sleep. Now, one thing that a lot of people don't know is that coffee and alcohol drain your magnesium, which then increases your hot flushes. So watch out for your alcohol and coffee, and maybe take more magnesium.
Great advice. Thanks so much, Dr. Frances.
Pleasure.
And if you are concerned about anything we have discussed this morning, please contact your own healthcare professional.